So what brings you in today?
I'm having some chest pain and some upper abdominal pain.
Okay, and when did that start?
Probably about an hour ago, I was mowing my grass.
And did they both come together, or did it start with one and then the other, or
The chest pain came first and then it moved to my stomach, but now it's just,
all over?
yes.
Can you describe the chest pain? Is it sharp? Is it stabbing? Is it
It's
pressure? Or what's it like?
It's very sharp, and I'd say pressure lower when it goes to my abdomen, but it's just very sharp, right?
Does it go anywhere else into your back, your shoulder, your jaw?
My shoulder feels tight, but I don't know if these are associated.
Did it start though after your chest started, or?
Yes.
Okay, so the shoulder is new also, just in the last couple hours.
Yes.
Any other symptoms with it? Did you break out in a sweat? Did you get short of breath? Did you get nauseated?
All of those, but I don't know if it was because I was mowing the grass when I was sweating, or if it was because it was hurting. Nausea, I've had a cardioversion before, and I think it's more of a nervousness of what's coming.
Okay. Tell me about the cardioversion. What kind of medical history do you have? Do you have heart problems?
I've had heart history, but I also have Wolff-Parkinson's syndrome.
Okay. When you say a heart history, is it the Wolff-Parkinson's, or do you have other heart problems? Do you have coronary artery disease? Have you ever had a heart catheterization?
No.
Have you ever had a stress test?
Yes.
You have had a stress test. When was your last stress test?
I don't remember.
Okay.
I'd probably say a couple years ago.
Okay. And when you had your issues with your heart, was that why you had the stress test? Is that when they diagnosed the Wolff-Parkinson's?
Yes.
Okay. Did anybody ever talk to you about doing an ablation or any kind of procedure for the Wolff-Parkinson's?
No.
Because you only had the one episode. Is that all you've had?
Yes.
Okay. Anything run in the family related to the heart? Do you have any relatives who had either a heart attack or angina or heart failure or anything called coronary artery disease, say under age 55?
My grandfather on my mother's side.
Okay. Is that the only one?
Yes.
And do you have a history of any risk factors such as high cholesterol, high blood pressure, diabetes?
I've had occasional high blood pressure, but nothing.
Nothing they've ever treated?
No.
Okay. Are you a smoker?
No.
Do you do drugs, street drugs?
No.
Okay. Are you on any medicines right now for your Wolff-Parkinson's?
Inderol?
Okay. And do you know how much of that you take?
I don't.
Okay. How many times a day do you take? Not sure? Okay. Have you taken anything or done anything since this chest pain started? Have you taken any medicine for it?
I took a baby aspirin,
Mhm.
and I just came straight to the ER from there.
Okay. And on a scale of 1 to 10, how bad is your pain right now?
Probably about an 8.
Is that what it's been the whole time, or was it worse before, or has it gotten worse?
It's probably stayed about an 8.
Okay. I'm just going to ask you a few other questions about stuff that may be or may not be related. Have you been running a fever recently? Have you had a cough, sore throat?
No. No.
Have you passed out? Have you felt like you're going to pass out?
No.
Any change in your bowels recently? Any urinary symptoms, burning, frequency, urgency?
No.
And anything like leg pain or swelling or rash?
No.
Anything else you think I should know about you or about what's going on that I haven't asked yet?
I don't think so. I think I've got enough going on.
Okay, we'll go ahead and examine you then. Open your mouth for me. Okay, take a look up. Turn your head. No JVD. Touch your chin down to your chest. Okay, go ahead and sit forward. And deep breath. Again. Scattered basilar rales, few bronchi bilaterally. Any soreness here?
No.
Okay, go ahead and lie back. Tachycardia, about 140. Irregularly irregular. Are you tender in the belly?
No.
Okay. And not sore down here?
No.
Okay. listen to your carotid arteries here. And hold your breath. Go ahead and turn this way. Okay. 2/6 carotid bruit on the right. All right, well, your heart's kind of racing. We're going to have to do some tests to see what's going on, give you a little bit of medication to help with that. And then if you need anything for pain or nausea, we'll certainly take care of that as well. Do you want a little something for that right now?
I take something for the nausea.
Okay. So we'll do 4 of Zofran, and then other orders will be CBC, basic metabolic, troponin, BNP, portable chest, and magnesium, and we'll start with that, and then after I see the EKG, we'll decide on other medications and what we need to do. Okay?
Sounds good. Thank you.
All right.